When we find that a patient has an abnormality, I and my colleagues have come to understand that this is a very tense time for a patient. And we begin thinking of how we can do things most quickly to address their concerns and their medical problem. One thing that we need to do is to sit down and explain things to the patient and give them a visual on how the process works, what we need to do next, what we can expect next, what the choices will be. And while it's overwhelming to the patient to start with, I find that going with the same basic information repeatedly and putting the new information in focus in terms of the plan helps to lock in for the patient what's going to happen to them and allay some of their fears. So in the case of a mammogram, when we find an abnormal mammogram, we quickly move to a biopsy. And if there's a cancer diagnosis, then we quickly try to get them in with one of the physicians to start talking about what do we do with this diagnosis. And if that happens to be me, what I will do is explain the spectrum of what is expected to happen: surgery, medications, perhaps radiation therapy, and all of the decisions that will come and the variables and how we will decide from one step to the next where we're going. We speak of dealing with cases and with medical information, and I think one thing that I and my colleagues have realized, and that is that we're not dealing with cases, we're dealing with people. And I think also most of us realize that at the center of a good experience and a good medical therapy is paying attention to the patient.